Right. So today for FND Awareness Day, FND Awareness Day Australia, we have Alison Fenton, who's a senior neuro-physiotherapist for active rehab, and she's going to talk to us about physiotherapy intervention for FND. Okay, so your host.
Just about there, just setting up my screen. And I think they're ready. Thank you so much, Catherine. And I'm so excited to be able to talk. So it's such an honour to be able to present and share about the role of physiotherapy in the context of functional neurological disorders. My name's Alison Fenton. Just a wee bit about me. I grew up in Brisbane. I'm a Brisbane girl, so I certainly grew up playing a lot of sport. When it was time for me to pick a career, I wanted something that still involved that sport but had a bit of variety. So I had the good fortune to do work experience in a hospital, and whilst I was there, I noticed the large area or the large variety of area that physios could work in, and not really having a one particular area. I went, right, physio seems like the good thing to do, and I really like variety, and this has been the history of my career. So I have worked in Sydney, I have worked in London, I've been back in Brisbane, I've worked in hospitals, private practice, special schools, in nursing homes, in rehab settings, and I've run lots of exercise classes. So I really, really like that variety, and I've been working here at Active Rehab Physio for about 4 years. And one of the key areas that I love and I'm very passionate about is helping people with functional neurological disorders. Through this, I am a member of Dr. Alex Len's FND teaching team, and he's a very passionate Brisbane neurologist, and we aim to educate and train other health professionals in FND management, not only in Queensland, but throughout Australia as well. So let's get started. In this presentation, I'm just going to summarise a wee bit about FND, because I know that there will be other presentations talking more about this. I'm certainly going to discuss the role of physio in FND, and we'll talk about the difference between usual physiotherapist and a neurological physio, or certainly a physio that's experienced in working in FND. There are some good evidence, there's some evidence certainly around that shows the benefits of physiotherapy, and in this I'll cover what we would do in a typical session. We look at things like confirming FND. I'll talk more about this as we go. I'll talk about some of the education we show clients, and at the end we'll finish with some top tips. Functional neurological disorder, I would normally explain to my clients, is an involuntary, faulty habitual patterning of the central nervous system. And it's hard to shake because of excessive or ongoing internal attention, which means focus on your symptoms, which is the human nature thing to do. If things aren't working well, of course, we're going to focus on them. But in FND, it makes it hard to shift. Another explanation that people might commonly read is that if the brain was the computer, the hard drive of that computer is fine and working, but there's a glitch in the software, or certainly the way it controls either the body or the senses. FND can present in lots of different ways. For this presentation, we're going to say that essentially there are two main types. So one involves functional movement disorders, and the other type is involving dissociation. And for those who aren't aware, dissociation is when your nervous system disconnects from yourself, really. You can't either feel or control your body. You may not be able to note the environment around you. You don't feel like part of what's going on, or you can lose awareness of what's going on. So it can look like you're fainting, or it can look like a seizure with jerks and shaking. People can certainly have all sorts of sensory changes. We can have bladder and bowel difficulties. We can have speech and thinking difficulties like I am during this presentation. We can have tremors, jerks. We can have episodes, as I said, that look like seizures. There can be cramping, weakness, and paralysis. And this isn't the full list. So symptoms of FND can be many and varied. The statistical, or the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, and again, you may have heard of this already listening to these presentations. It describes FND as having symptoms that are variable or inconsistent, that do not fit the pattern of any other known neurological condition or illness, and certainly is sufficient to warrant seeking medical attention. FND is never diagnosed because you can't find anything. It is only diagnosed because of this variability and inconsistent symptoms. And it's important to note that the DSM-5 removed the requirement for any sort of recent psychological stressor, which there are some people who still believe it should be involved, but we know that there are plenty of people who have no psychological concerns, no worries, no anxiety, no adverse childhood events, and still develop FND. There are some beautiful consensus documents about how to manage FND for physiotherapists. So if someone is seeing a physio who hasn't had experience in FND, this is a really great resource to share. Essentially, we demonstrate when we see a person how normal movement or better sensation or better control can occur. We work on retraining movement and working out strategies that will help. And we'll look at that person and they're probably a bit deconditioned. They haven't been doing as much as they would do normally, or they might have some quite unhelpful thoughts or worries about their condition, and we'll try and talk them through that. We find education's a really essential part of helping people who have FND. And as we said, we try and work on improving people's understanding, their acceptance, and their self-management. We do focus, and you can see in the center of this picture, on some core things. So we do focus initially on weakness or paralysis, any sort of movement issues the person has, shakes, tremors, jerks, if they have attacks or fainting, if we have any sensory issues. Now I'm just, can you see me still? Because my background light's gone. Yeah. If they have any sensory issues, so they have numbness or weakness, or they just don't feel there. But that does spread out into other areas. So we can also deal with pain, or headaches, people that don't sleep well, people that have swallow or sleep issues, and certainly bladder or bowel dysfunction. And further flowing onto that, we see people who have anxiety and mood changes. And each of these factors can certainly be connected to each other. When we think about physiotherapy, and it's not uncommon for me to have someone to come in and go, I've seen a physio, I don't know what you can do. I think usual physio, and the image of usual physio is someone who's working on those muscles and joints, and they're doing exercises and they're giving you prescribed reps and sets, and they really focus in on that body part that's not working well. Well, unfortunately, this doesn't always work so well if you have a functional condition. if you're seeing a neurological physio, well, we're someone that specialises in treating problems related to the nervous system. So that's the brains or nerves, and in a way that we look at the way that a person functions or moves. Anyone that works with FND try and take advantage of the phenomenon called neuroplasticity, which is that fabulous ability of that brain both to lose but also to form new connections. And that is a lifelong process. While we live and breathe, we will always have that ability to have neuroplasticity. So in FND treatment, what we try and do is help the brain to rewire itself to either relearn tasks or relearn abilities. And when we see people with FND, what we'll do is look at some sort of way of testing their movement without focusing on those individual body parts. We'll look for, we call them positive signs of an intact nervous system. And I'll talk a little bit more about that later. We talk about pacing to minimize symptom flares, attention to distraction, external focus. We're all in all very holistic. And we try hard to work with a psychologist, if there is one as part of this treating team, OT, a speech pathologist, anyone else who is helping this person with their varied symptoms. There's evidence in both inpatient and outpatient settings that reassure us that physio helps. This evidence covers anything from showing that providing education, say in an acute hospital setting, just doing education alone, not doing any other therapy, just showing someone what this means and how to understand it can improve 20% of people without any other therapy. I mean, that's extraordinary, and that's why education is such an important part of management. Some studies are looking at helping people daily for a week. Some of them are helping weekly for anywhere between 6 and 12 weeks. And it's very, very interesting whether it's that really intensive short-term week or whether it's the longer help. But we do know that generally across studies, about 70% of people improve in their symptoms and measures of well-being. And these effects, these improvements can last for some people even up to 2 years, depending on the study that you read. Best evidence shows that management is through a multidisciplinary team. So that's a combination of having some psychotherapeutic strategies to help us with our thinking and our thoughts, and also some sort of physical strategies. And that could be through physiotherapy, occupational therapy, speech, a clinical nurse could be helping, a social worker, an exercise physiologist. But ideally, we see someone who has some knowledge or experience in FND. We can use, as I said, some on the screen techniques, including graded, which is very particularly paced exercise. We do things called graded motor imagery, which is like visualization or mental rehearsal. There's some emerging studies coming out on the use of virtual reality, which is pretty cool. Sensory reintegration, so trying to work on getting back our feeling and our appropriate feeling and sensations. As you can see, with encouragement of helping that person take control of their own symptoms, managing their activity, managing their relaxation. And most of this evidence is with working on motor planning strategies. That last sentence is absolutely true. There is no one size fits all approach with FND. Everyone is so different. Everyone has different experiences. What helps one person may certainly make someone else worse. So all treatment in FND is very, very individualized. A typical session, sorry, there's so many words on this screen, but a typical session for patients with FND. Someone will come in and we take time. We always take a lot of time to take a really thorough history. We're really interested in all the symptoms that that person has, because people sometimes, again, think physio. They're interested in my walking, and they forget to tell you that they're having problems with eating, and their sleep's different, and their toileting is different, and their brain's a bit foggy. Oh, and sometimes their vision just tunnels down. And when you start asking the person, it paints a really big, broad picture of some of both the challenges that person's having, but all the various ways that they're being affected. And it helps us get to know them. And with that, we can start to work out what sort of triggers may be contributing to their symptoms. Not always known, but we'll start with trying to work things out. We look at activities that make things worse, and that can come into some of the triggers, and activities that ease their symptoms. We're interested in that 24-hour pattern. When's it worse? When's it easier? How are you managing your day? What's your sleep like? How much sleep are you getting? Have you got any other health conditions? Because as you may be aware, just because we have a functional condition does not mean to say that you cannot have another condition at the same time. A good proportion of people with epilepsy also have non-epileptic attacks. People can have heart conditions, arthritis, neck surgery, a wrist carpal tunnel syndrome. There's a whole lot of other things we can certainly have at the same time. It doesn't mean that it's one or the other. We like to get a measure of that person's understanding and acceptance of FND and symptoms. And part of that is because in working with people, and I see in my workday, I see quite a lot of people with FND, so I'll probably see somewhere between 6 and 8 people every day. We find that people tend to do better if they understand FND. They certainly tend to do better if they if those symptoms resonate with them and it makes sense, so that they are accepting of their symptoms. There are a couple of other contributing factors that determine how well people do. So, of course, the longer you've had your symptoms, the harder it is to change. It doesn't mean it's not possible, but it's hard. And that presence of multiple psychiatric or other mental health issues, that makes it harder to shift your symptoms. But again, everyone is different, and it's often really humbling and difficult to work out who will do well and who will still be struggling. In our session, we make a point of reassuring the person that their condition's real and absolutely not all in their head. And if they have any questions, we take the time to try and answer those. So we'll discuss the role of physio. We'll talk about what FND it is, what contributes to it, how it's diagnosed. If dissociation is a feature of their symptoms, then we will go through a dissociation management plan. When we assess their function, we will look at movement. We'll look at fatigue. We'll look at things like walking or do some balance tests. We'll make an action plan. In our practice, we tend to do an initial 3 or 4 month plan. And we have a really strong focus on teaching self-management. And no one ever leaves without education and a workbook or some sort of homework. In that first session, we talked about looking for positive signs. So positive signs are where someone will have weakness or difficulty in moving, particularly when they try really hard. They really concentrate on that muscle or that joint. In FND, it's like the thinking part of our brain gets involved in it. It affects the way that we move. So if we can trust that we can move more automatically, often that movement's a little bit better, or we have a little better control. So if we just park that thinking part of the brain off to the side and get it concentrating on something else, we sometimes see that movement is still there, And that demonstrates to us that their nervous system and their muscles and joints are still working. We've just got to get that connection happening. There's quite a few positive signs that as a physio that we can look at. Dawn, for the physios, Dawn has listed a few of these with their relevance. One really common one that we would do in assessments is a Hoover sign. So for people that have leg weakness, what we do is we'll sit them down. Got great line drawings here. We'll test, for example, that left side and put a hand underneath and get them to push down. And when they're focusing on it, if they have leg weakness on that side, often it's not really strong. So then what we do is we put our hand on the other side and we get them to try really hard to push up. And automatically what's going to happen is when you're trying to push up, the opposite side is going to brace. You're not even thinking about it. It braces and we keep our hand there. And if we notice that that strength underneath that left leg creeps up and increases and becomes more normal, we go, well, that's different. That's a sign of an intact nervous system. And we never hide this for our patients. We're not trying to trick people. We're trying to show them that we can find ways to get their legs to work. So I find it a very powerful tool, and we'll do this with balance. We'll do this with walking. We'll do this with arm movements and fingers. Sometimes it's quite hard and tricky to find a positive sign, but it's such a powerful tool to give people hope. I talked about giving people information about FND. We will share sites like FND Australia, which has all sorts of learning videos, great information both for individuals and for their therapists. There's neurosymptoms.org. I've heard this fabulous Society FND Australia Support Services, which has got great information. And we can look into other sites too. And sometimes I'll share this UK site that talks about non-epileptic attacks. There's a site specifically just for kids, about kids support, which is neurokid.co.uk. And this is not, there's a lot of other, there are other sites as well. Some of the things that we will practice with our patients, and again, everyone is different, but we work very hard on slow breathing. We do things like finding ways to distract that person or keep their attentional focus on something else to allow their body to work a little better, more automatically. We work on helping the person recognize early warning signs of symptoms, because if not everyone can do this, but if we are, that is the best time to use one of your distraction strategies. It's so much harder when you're on the floor and someone's trying to get you to ground. It doesn't work quite so well, but if we can catch the fact that we're starting to get a little sweaty, our breath's a little shorter, we might just start to get a little tingle in one ear, or our eyes are starting to get a little foggy. As soon as we get any warning sign for that person, that's the time to start doing some of your grounding or breathing or distraction strategies if you can. We'll make sure we are always super careful of language, and you can see me even pausing in this conversation. I am always so careful of the words I use. Having a team that talk to each other in helping a person is fabulous, where we are all consistently using the same language. So encouraging or any therapist to keep talking to each other's absolutely important too. And again, we always help people. We want to teach people to be able to manage themselves, because managing a functional condition is usually not a sprint. It's generally a marathon. Brain training is not a fast thing. Brain retraining is not a fast thing. It takes time. So we want you to be able to manage all those ups and downs. We'll cover, I told you we're very holistic, so we like to get people moving, but again, not the conventional, typical, running laps around the oval. I might have, as an exercise for someone who has difficulty moving, standing up and down 5 times as they breathe out. And that is their homework for me for the day. Okay, and some people go, well, that's nothing. But for that individual, it's a lot. It's a lot. And what we're trying to do is to encourage that brain-body connection. And we don't have to do just leg activities. We can do non-specific exercise, because once that brain starts to connect better with the body, it's quite interesting. Quite often you get a lot of improvements in some of those other senses as well. Good quality sleep is absolutely essential. And we might direct people towards sites like the Sleep Foundation, which have some good basic information on sleep habits or hygiene. Talking to your GP or seeing a psychologist trained in cognitive behavioural therapy for sleep could be helpful. There are therapists that do that. Anyone with additional significant anxiety or mood issues could certainly benefit from a neuropsychiatric review, and perhaps they could have some medication just to get them a little more level, so that then they can use their strategies to help with their functional symptoms. So we always encourage that balance between therapy and having fun activities in life. I mean, don't tell anyone I said this, but there's more to life than just physiotherapy. So we want this part of your everyday, not your whole everyday. And when we're having fun, our brain works better, it links better, we get more control. So it's certainly super important. And I hope you're enjoying my social support. So we all need friends in one shape or another. Finding supportive social networks, whether it's family, friends, support workers, co-workers, support groups, makes the world of difference. And having them understand your condition and know how to support you in a very calm way is super helpful. I probably want to say some of the key points are in helping people with FND is just having that clear diagnosis. It's so important from your movement specialist or from your neuropsychiatrist. There's definitely an increased chance of improvement, as I said, when you have good understanding and acceptance of your condition. And it's both for the patient and, dare I say, for the treating therapists. So always feel free to share any educational information you have. We cannot cure ourselves of FND, and I wish we could, but you can't cure the fact that you may have had a stroke. We can't cure the fact that we may have had a heart attack. What we want to do is live a balanced life. We learn to manage our symptoms, just like you would after that stroke or heart attack. We just want to look after ourselves holistically. Pacing your days and your activity or your exercise is absolutely essential to avoid the boom bust flares, and it's always one of the struggles with people we see. Symptoms are always up and down, always, and I think if you understand that, it makes it a little bit easier to accept. We see a flare-up of your symptoms, not as a back to square one, but really as a learning opportunity so that you can reflect, think about what might have contributed to that. We learn from it so that we can pace ourselves again a little bit differently. We may have gotten out of the habit of doing our exercise. We may have lost our good sleep. We may have had quite a few other, I've had a lot of people having to move house recently with all the floods up here. And having that stress in the background, even though stress isn't a typical factor for some individuals, it makes your brain work harder, and the brain's not always linking quite as well with the senses and symptoms that that person would have. The best news of all, however, is that brains are forever, great word down there, adaptive, and we can retrain our brain. So I wanted to leave you with that final take-home message. Physiotherapists can absolutely have a significant role in supporting people with FND. And
Thank you.
there are, oh, my absolute pleasure. I'm going to leave up this site. I've got some references after this, but there's great sites that people can look at, and these are things that we will share with people. So fndaustralia.com.au has a brand new online learning resource for people with FND. Hot off the press, it's only just been released and free and available for anyone who has symptoms of FND and would like to learn more. And it was created in association with people who also have FND. Neurosymptoms.org has good sites. There are apps for those app lovers.
Just found our app.
Yeah, I know about your app. So I've recommended it to people. So your app is
Fantastic.
there. My FND is another app. Neurosymptoms.org has got an app for some awesome information about breath and the role of how breathing helps the nervous system.
Really does.
Yeah. And you can see the other sites there. And I hope that's been of interest and relevance.
Yeah, no, really, really good, really helpful. Yeah, and I like that holistic approach. Yeah, as an OT, we also come from that holistic approach and look at sleep. And the other thing I liked was you talked about fun. And that's what I think is really important. A lot of people sort of think, physio and exercise physiotherapy, I have to go and do exercises and that sort of stuff. But making it fun can be so important. Yeah.
Oh, essential.
Yeah.
Life's short and this is long-term stuff. So if we're going to have to be doing something, if there's any way we can vaguely enjoy it at the same time, even if it's simply by playing the music that we love at the same time.
Yeah, the music is one that I like. Music, or even watching TV or something, having a conversation. Yeah. Listening to audiobooks. The other one that I sort of started doing is some movement or dance or Tai Chi, yoga, that sort of stuff, trauma-informed yoga as well, just to do something different.
Yes.
Yeah, and then that helps with that breathing, that deep breathing.
It is, particularly when you're doing the Pilates or yoga or Tai Chi or any of the activity types where you're incorporating your breath and movement.
Deep breathing, yeah. So we had a few questions from our members. One of them was around, and I think you started to look at that, how we manage your triggers, and I think you covered that. The other one was around, which you didn't touch on, is the use of walking aids, mobility aids. And it's really, and as an OT, obviously this is an area that we come into. Obviously you want to do your rehabilitation, get as far as you can go. But for some people, they don't get to a point where they can have that functional mobility, where you can go to the community, go to the shops, catch a train, that sort of stuff.
Yes.
So at what sort of point, or what might you do with walking aids? What's your kind of thoughts around that?
It's a good question, and it's a question that comes up fairly often as well. Certainly when someone first has symptoms, we try not to use walking aids, and that's in their consensus guidelines as well. For the reason of, even though it is hard to walk and your balance is off, we want to give your nervous system that chance to be able to restore itself and correct itself. And we don't want people to become reliant on aids unnecessarily. But there's absolutely a place for sticks or wheel walkers, or even wheelchairs for some people, depending on their flair and their safety. And so I think we just have to keep an open mind as therapists when we prescribe aids. But I will not ever send someone home in a wheelchair who has difficulty walking and expect them to sit in that wheelchair the whole time until they come to their next session. If they have that capacity to get up, I will be absolutely encouraging them to move where they can, and not to overdo it on their good days, but certainly keep themselves shifting and moving. And remember that aid is hopefully only a temporary device.
I mean, I probably see a lot of people who've had FND for like decades and quite severe, and obviously you've also got some secondary changes happening there as well, and with also complex comorbidities as well. And it's almost, one of the big things about FND is the variability in symptoms. You know how sometimes you can be paralyzed and not able to walk, and then other days you can walk, and that could happen within a day, or it could happen within a few months. And trying to manage what you do in those variability of symptoms. You know, if you can't walk on a particular day, but you've got to go somewhere, you know, how are you going to manage that?
That's right.
Yeah, it is really hard. And then the issue that I sort of see, especially for young people, is there's some days they have to go to school in a wheelchair because they're not walking on that day.
Mm.
And then they go to school on another day and they are walking.
Yes.
And then, you know, they're accused of faking and sort of the bullying that can come up, and people not understanding that some days you might need a wheelchair and some days you don't need a wheelchair. And you don't want to stay in a wheelchair if you don't need it. You know, you want to be maximizing your function where you can.
That's right.
So that's sort of one of the tricky areas. We sort of look at, you know, different aids for different days, that kind of stuff.
Yes.
But yeah.
No, I agree with you. And I just want to, I absolutely agree. I mean, if a functional condition is not your fault, you're not wanting to not move. You're not. Yeah. This is a real condition. Just some days your brain connects, and some days it just doesn't. And you know, we've just got to be able to be safe. Yeah,
exactly. And also be able to do the things that you want. So, you know, if you cannot leave the home because you can't walk for further than 5 meters, you know, you still want to have that quality of life. So it's how do you maximize your quality of life and still do the things that you want to do?
That's right.
Yeah. When working with people, so obviously, you know, people with FND often have a lot of sort of complex comorbidities, and there's, you know, chronic pain. People, you know, have POTS. They've got, you know, postural tension thing, you know, severe chronic fatigue, and then, you know, episodes of paralysis. So how do you work with people when they've got sort of those complex comorbidities? Do you use your graded approach?
I absolutely do. We have because we're part of a teaching team, we do tend to see the more complex patients anyway in our service. And the majority of my patients will have severe chronic fatigue as well. A very good proportion have persistent pain. People can, you know, I've got a few patients that do have leg paralysis as well. And again, we always grade our activity according to the patient as they come in. And there is evidence to show that for FND with these comorbidities, whether it's chronic fatigue or persistent pain, postural hypertension, or postural orthostatic, you know, the POTS, I'm losing my words. FND is striking me as well, but with people with complex conditions, we grade our activity accordingly. We look and we try and just look at people's thinking to make sure that people are realizing that even persistent pain, even chronic fatigue is still something that can be changed. And it's we work with them with their pacing, with their understanding of pain, with the way that what they're focusing on and how they're managing their life, and looking holistically is super important.
In terms of that longer term management, like you sort of spoke about 6 to 12 week program, after people have done that, you know, a lot of people will live with some level of symptoms long term.
Yes.
What do you tend to do for sort of longer term management of FND? Do you keep seeing people? Do you see people periodically?
It sort of varies. We are in a fortunate position to be able to support one of our teaching hospitals for up to 6 visits after they've been seen. So that's where I think we initially found that we could make significant changes over that 3 or 4 month period. Longer term, I have patients who feel that they have the sufficient knowledge to be able to manage their symptoms independently, and they touch base with me periodically, just if they have any problems that pop up, or if they have a flare and they want to chat about their management. We see some patients periodically. It could be a monthly touch base just to see where they're at. Where we can, we try and encourage people to continue that touching base with a local therapist or a local support team they have traveled to see us from a distance. But part and parcel again is trying to get that confidence and really sufficient understanding of how to manage yourself every day, how to manage your flares. What do I do in my situations? When do I need to go and see a doctor? When do I need to call into the hospital? When can I continue and do my usual and know that I just have to be a bit kinder to myself?
Yeah. And we do see a lot of people who don't have access, especially depending on where they live, especially if it's rural or remote kind of area, so they don't have access to, neurophysiotherapists. So people have been wondering, what can they do for themselves, at home? So we support people with education. We do, some telehealth things, but what can people do for themselves?
I think what you just offer is fabulous. I feel for people that don't have good internet access or don't have good therapists. For those that do, if you look on sites like FND Australia, you can access sometimes telehealth sessions from therapists who are experienced with FND. For those that don't, contacting organisations like yourself who can share information and give that person strategies to recognise and manage their symptoms is helpful. And as I said, studies have shown that there's a significant proportion of people who can learn to control and improve their symptoms just by understanding about it better.
Yeah, and a lot of people are so confused and they haven't had that education. People sort of talk about, they've been diagnosed in hospital, maybe given a piece of paper with a label and then sent home with nothing. And so by the time they get to us, they're confused and frustrated, and it's a scary condition if you don't understand it.
It's a very scary condition, and as I'm sure you're aware, the average time for people to be diagnosed is about 7 years. And that's a long time to be told all sorts of things, to have conflicting information, to have all these secondary complications through not being able to do things as well as you'd like for such a long time. Yeah,
or be given the wrong kind of treatment as well, especially with like epilepsy, being given epilepsy meds.
Exactly.
So, and look, I've seen people up to 20 years and they said, I finally found your website and this is what I think it is.
Yes. Information's gold.
Yeah, it really is. And once you can understand it, and then you can learn how to manage it. I know for me, just getting the label was so important, because when you don't have the label, you don't know what you're dealing with. I've had people that have thought, well, maybe I have a palliative condition because something's really wrong and we don't know what it is. Yeah. Cool. All righty. Well, thanks so much for your time. That's been wonderful to touch base and see you. I see your name on reports and I see your name coming up all the time. So good to finally meet you.
Oh, it's lovely to meet you too. And I'm as I said, I'm so thrilled to be invited to present. I feel very passionate about helping people with this condition. So thank you.
Yeah, thanks so much.
You're welcome.